First, I want to just thank Linda for letting us all intrude into her home, and I know a number of you are going to talk a little bit about your personal history and connection with not only the new law, but what your experience has been in the health insurance area as not only a former governor and former insurance commissioner, but as a mother and a consumer. I think that women certainly have the most to gain, because in many cases we were the most discriminated against in the existing situations. We have had a system where insurance companies got to pick and choose who was in and who was out, and could lock people out, price people out, and dump people out of the marketplace. And I think it has worked particularly badly for women. Women can pay up to 50% more, totally legal, for exactly the same coverage as their male colleagues pay. That will, as you all know, no longer be the case. And health care plans, even with that 50%, often did not cover the services that women need. More than half, almost 60%, for instance, of the plans in the individual market don't even offer maternity coverage. Good news is that discrimination comes to an end. Being a woman is no longer a pre-existing condition. Starting in 2014, that's a big step forward. It really does have an impact on people's everyday lives. Some of the implementation is in place right now. Others will be in place in 2014, and thanks to the leadership of governors like Governor O'Malley, we have some states who are moving ahead, starting the framework, starting to do the outreach, and really making a difference for their citizens. So I'm just delighted to be here. I want to be talk to you all about what's going on in your lives and what you see coming, and make sure that as we think about policy decisions and implementation decisions, that we're informed by what's really happening on the ground.
I'm healthy. I have great health insurance through my job. Never really thought that this bill, this law, would really affect me quite as much. And then I got pregnant with Jax. Jax is a twin. He and his brother were born in August. In my second trimester, I found out that Jax, that our baby A, was diagnosed with trisomy 22, which is a genetic disorder called cat eye syndrome. And along with that, along with several other possibilities, he had a heart defect. They were born at 36 weeks with a C-section, and Jax immediately went to the NICU, and he spent 3 weeks there. In the 3 weeks' time, we found out a lot of things weren't going to be something we had to worry about that was part of this genetic disorder, but the problems with his heart were more severe than they thought. His heart is actually on the wrong side of his body, well, of his chest, not like in the back, but of his chest. His intestines are backwards. He may have vision problems. He might have cognitive problems, but the heart was the most concerning thing at that time. After 3 weeks, they sent him home to grow and develop so he could be a little bit stronger for his surgery that he would need. They sent home a fairly listless, kind of blue baby. We took him to a lot of doctor's appointments. It was very stressful. We had to make sure he wouldn't cry too much or his heart would stop. We'd have to call 911. And we have his twin and 2-year-old sister as well. So it was a very stressful time. In November, we took him for his surgery. He responded immediately. He came out a pink baby. He moved a lot. It was an amazing difference.
So when was his surgery?
November 22nd.
Okay, because he looks terrific.
He does. It's an amazing difference.
Yeah.
The life-saving care that my son has had has just been amazing, and we're very thankful for the care that he could get. The ACA affects us in 2 ways. One of those ways is with the lifetime limits. I don't know exactly how much all of his health care has costed to this point, but in 5 months, I know it's got to be a lot. The first day in the NICU was over $150,000. If he, in 5 months, used up the lifetime limit for him, my family would be in really dire straits. He's going to have follow-up visits, potentially follow-up surgeries. We would move mountains to pay for health care for this child. We're very glad not to have to. And
the other thing is he'll be able to get insurance when he grows up.
Exactly, and that was going to be my next point. I'm very happy that I love my job. I don't plan to leave it anytime in the near future, but if I had to stay there until he graduated college to keep him on my health care, that would change things a little bit about how much I love my job, I'm sure. to know that we don't have to worry about that for him is an incredibly big deal, and it's a wonderful thing about the ACA.
Still the #1 cause of bankruptcy in this country. So having families not have to think that if they get sick or their child is sick, they will lose everything they've worked for is a big step forward.
On a Friday afternoon in October, I took my 2-year-old Evie to her pediatrician's office for what I thought was a minor kid illness. On Monday morning, the pediatrician called while Evie and I were out shopping for her big girl toothpaste. The pediatrician had some unexpected lab results. It looks like leukemia. Go directly to the Hopkins ER.
Oh my.
In that instant, our lives turned upside down. Evie was inpatient at Johns Hopkins for 24 days while she started intensive chemotherapy for leukemia, the most common childhood cancer. These are Evie's courage beads. Each color bead represents a treatment milestone, a needle stick or a blood transfusion or a spinal tap. We are lucky that Evie's prognosis is excellent, but those first weeks were overwhelming to say the least. We had to learn a new language of leukemia and its treatment. We had to figure out how to explain this terrible new world to our 2-year-old. I watched my little girl lose her hair. I watched her lose her ability to walk. And I worried that we would lose our health insurance. Evie's hospital stay cost $100,000. She has
Those first 24 days.
Those first 24 days. And she has 2.5 more years of chemotherapy ahead of her. Being uninsured is not an option for my family. Our health benefits are provided by my employer. My husband's a small business owner. I was unsure of my ability to return to work. I thought I had some time to figure things out between vacation time plus family medical leave, but those two things can't be added together. And my family medical leave was prorated because I'm a part-time employee. So I burned through family medical leave before I even used all of my accrued vacation time. My husband's small business has always offered health insurance to employees, so that's an option for us. Fortunately, coverage of Evie's pre-existing condition would be protected thanks to the Affordable Care Act. But I worried about continuity of care for Evie and about affordability for us and for the company.
Sure.
Would a year of Evie's claims make health insurance cost prohibitive in the future, jeopardizing coverage for my family and my husband's employees? Was COBRA a better option? What would happen when our COBRA ran out? It became an exercise in counting the months and days to see how we could make it to January 2014 when the Affordable Care Act is more fully implemented and we have more options for coverage. Evie's responding well to treatment, and I've been able to return to work and maintain our health benefits for the time being. But as Evie enters more intensive chemotherapy cycles, our delicate balance could crumble. Childhood cancer is cruel. To have to worry about how your child will get treatment and how you will maintain your family's most basic financial security is also cruel. The people in this country need and deserve a better system for ensuring access to health care. When discussing health reform, we often talk about our goal of protecting the most vulnerable among us. What we forget is that we are all vulnerable.
You bet. Well, and I know 2014 is coming, but clearly not quite fast enough. But hopefully there'll be some security nets in place in the meantime. And boy, it's a terrible situation for any parent to watch their child be ill, not be able to fix it, but to have that underlying issue of, can I get the treatment? Can I, what's going to happen as next step? As you say, your husband and his business, I mean, it's just incredible. So good luck to you and Evie, it sounds like, and her courage beads are impressive.
Yes, it will get longer.
That's better than any general's strike, that's a...
She'll have these forever.
Yeah, you bet.
I have to read from my story because I want to make sure that I get every important point. My job ended in October 2008. I had 100% major medical. I only had to pay a copay of $20 at the most, and all that abruptly ended. I could not afford COBRA. Now I'm at the point where I'm literally naked with no insurance protection, an unbelievably horrible feeling. Now because I have no degree and I'm a little over the hill and not quite yet ready to retire.
You can do it.
According to the corporate world, it's become quite the challenge to secure a full-time position with benefits. Now begins my Cinderella story. I received a letter from the Baltimore medical system Miss Ophelia Montague, which is right back here. She called me and she asked me if I needed a mammogram. I was speechless because I'm sitting there at my desk most of the days wondering how I'm going to get this checked out, because the worst fear is not knowing. To be honest with you, I just wanted to cry, and Miss Ophelia was able to help me to get the mammogram, a follow-up that was needed, a diagnostic that was needed, and the examination at no cost. I'm so thankful and totally indebted to the program. Words don't seem to do justice for potentially saving lives. I'm glad, it's a godsend that the Affordable Care Act would allow me to be free from this type of worry in the future. It's an honor to be given this platform to speak on behalf of other women in my community with the need and no voice. I agree with the President that healthcare should be a right and not a privilege.
I've always taken health insurance for granted. I grew up as an Army brat, and my parents were both military career. So we just thought that's just something you get. And my husband got sick with leukemia in 2007. And I quit my part-time job to work with him. I did not have any benefits of my own. And I was raising 4 children. 2 of them had launched to college, and it was about the busiest time a family could have. One in high school, one in middle school. And we just wanted him to get well. So unfortunately he did not, and he passed away in June of '08. Yeah, and he was a senior VP at a securities firm, so we were very covered with benefits. And I didn't know the details of COBRA, but we had it, and it was a great security for me until I started paying the premiums for a couple of years with no salary. I went back to school in social work because I had to build a career for myself. I'm not old enough, I love saying that, to retire. So I have a few more good years in me. So we go through the change. My daughter graduates from college. She's dropped from the policy because of the ACA hadn't come into effect yet. So she has been in and out of policies for the 4 years she's been out of school. So I started thinking at some point that I needed to get my own policy and get off COBRA. It was expensive, and I needed to start conserving. I was living off life insurance and had no job while I was going to school. So I applied to Blue Cross of Maryland and got a note back that I was just flat out denied. And I said, what? Do you want to look in my medicine cabinet? I take no medications. I'm healthy. I exercise. I've had good primary care my whole life. So at that point, I just felt really shaken that the system had let me down. And I just thought, I'm not what I think I am. I'm not healthy. I started having heart palpitations. And, I'm 55. Even though I'm healthy, I thought I've never had an experience like that. And I was terrified to go have them checked. Because, my God, what would happen if I had a heart ailment as a pre-existing condition? So I waited, and I waited until all of the forms came through, and I finally felt safe. And I really had to just kind of sit on it for a month. Went to the cardiologist. Everything's fine. It was purely just stress. Just stress.
Well, it isn't just purely stress. You're suffering still a loss, a tremendous loss, but the fact that security is so shaky for so many people, and that they really can't count on it. I mean, you talk about your kids. I'll never forget John, our younger son, had a great friend who was sick as a child, and when he was 9 and 10, he was totally healthy. At 22, was an athlete, but because of that illness, and because he had graduated and again timed off his parents' plan, his father said to me, graduation weekend, I'll never forget this, he said, the good news is Heath has graduated. The bad news is I will pay twice as much for his health insurance as I did for his college tuition. And so he said, it's a mixed blessing, and it was so poignant. We've got 2.5 million young Americans now who are covered in their family policies up to the age of 26 that just didn't exist before. Young Americans are the second most likely age group to be uninsured in the country, and you are a car accident or a diagnosis away from a lifetime of bills and bankruptcy and for yourself and your family. So that's a huge step forward.
First, I'd like to thank you for inviting me to this roundtable discussion. I'm a home care provider. Every evening for 2 hours a day, I care for a 51-year-old gentleman. His name is Eddie, and Eddie has severe disabilities. He's homebound. I provide daily services like eating, feeding, bathing, dressing, and other activities for Eddie. And Eddie lives with his parents. They're in their 80s. They're very frail, and they have their own healthcare challenges. Fortunately for me, I enjoy taking care of Eddie, and I know that my presence in his home or just caring for him makes the world of difference for him. And the Affordable Care Act is one of the programs that I'm very pleased to know because it will create home care jobs. It will provide services for people like Eddie in the home, allow them to increase their quality of life on a daily basis. So I'm very pleased that I have this opportunity to share this at this meeting to let you know how important their Affordable Care Act is to create jobs for home care providers at livable wages, period.
When we talk about workforce for the future, not only needing more primary care docs, more nurse practitioners, more people delivering primary care, but the home health workforce is so very important to give people those options and those choices and to deliver the services, again, so you don't have to have very dramatic choices. I can either be in my house totally independent doing all the things I do, or I can be totally dependent on somebody else in a nursing home. And for a state or a county, the cost differential is dramatic. So to have that continuum of care, to have services around folks, we're really eager to find ways to deploy more home health workers, as you say, get people training and adequate salaries and the kind of work they need, but knowing how really important that is for a healthier system. So you don't wait until you get really sick, you don't wait until you get back in the hospital, you really have the kind of care you need on an ongoing basis.
I am a family physician and I work at a community health center, and so I'm sort of on a different side of things. I am the beneficiary of the ACA for multiple reasons. As a graduate from a historically black college in Nashville, Tennessee, I went to Meharry.
Oh, good.
And they historically receive students who are from disadvantaged backgrounds who may not traditionally go to medical school. And as a result of that, I incurred a tremendous amount of debt after school. And so faced with that, National Health Service Corps was presented to me as an opportunity to forgive some of that debt, and it also afforded me the opportunity to be able to work in the community where I grew up. So otherwise, I may not be able to afford to do that, and so it was a tremendous opportunity for me to be able to serve the community that gave me the support to be able to go to medical school in the first place. And also, as a family doctor, you want to be in a position where your patients can come to you. We're in place every day, serving the community and providing health care, and you don't want to hear the stories of the patients who can't come to you because they can't pay their copay, or because they're in some sort of adversarial relationship with their insurer, or they don't frankly want to tell you what is wrong with them because of what are the implications for later in the future. So from my perspective, I feel like the ACA is good because, number one, you put the healthcare workers in place to be able to receive those patients, and also you allow community medicine to happen. There are so many patients in this country who do not have access to care. And we are in people's backyards where patients who don't have transportation can go to the doctor down the street. So, it is a tremendous opportunity to be able to sustain healthcare in the community because it is a necessary vehicle to maintain the health of our community. And that's the goal, and I'm very happy to know that we have support in trying to maintain the health of our communities.
The National Health Service Corps is like the Peace Corps for doctors and medical providers, and it's a program that says if you will commit to serve for a couple of years in an underserved community, we'll help with scholarships or to pay off debt or to you know, it's kind of a win-win situation. It is deploying, you know, not only physicians, but nurse practitioners and mental health technicians, and putting them in the most underserved areas. We've also increased pretty dramatically the number of community health centers, again, in underserved areas. Some of them are in very rural communities, some of them in urban areas, or in school sites, or in housing centers where elderly folks live who don't have transportation. But again, it's trying to put a framework for primary preventive care into areas where people may, you know, be far away or not have access to a doctor. It's a health home. And I have been so impressed as I travel around the country. You know, part of the theory was, well, people go to a health center if they don't have insurance coverage. And what we found is that that is not the case, that about half of the population in a lot of the health centers are people have some insurance coverage. They just see it as their health home. They love the connection, and they are really community health centers. So they're in the neighborhoods, they're often doing things well beyond healthcare delivery. They're helping folks find jobs, connecting them with networks, you know, running child care centers, doing a whole series of services that really have to do with health and wellness, you know, outside of a physical diagnosis of what may be wrong. But congratulations, that's really an inspiring tale, and it's always great to see some faces behind the, you know, the statistics come to my office, but too often not the faces of these great healthcare providers.
In 2009, I was pregnant, so I called my insurance plan because I wanted to just check to see if they might cover midwifery, because I was having my baby at home with a midwife, and there's a lot of plans that unfortunately don't cover midwife services, even though the efficacy data is very compelling. So anyway, I call, I'm on the phone for about half an hour, 45 minutes, and she's trying to determine exactly, you know, whether I have that covered or not. And then she said, oh, actually, you don't have health insurance covered at all for maternity. You don't have maternity coverage. I said, what? I have to have maternity coverage. I say, there must be a mistake. She said, no, no, no. I have your application here. You didn't check the box. I said, what box? What do you mean? I didn't know that it was an add-on, that I had to check anything, and that actually it would be a higher premium, which she confirmed it would in fact be. So the bottom line, when I'm on the phone with her, I say, what are my options? Can I get help, you know?
You were pregnant then.
I was pregnant. How can I get covered now? I was like, I don't know exactly when. I was 8 months pregnant. The woman on the phone says, well, there's a 10-month waiting period for pregnancy.
Perfect. 10 months, so you can never, you know, perfect.
I laughed and I said, that's very convenient. So I got off the phone, I called my insurance broker, said, this is the scenario. Bottom line, it's a happy ending. I had the baby at home with a midwife, 8 pounds, healthy. It was a wonderful birth. However, the anxiety, the stress that I had to go through this whole time, grappling with this, was completely unnecessary. So I'm so thrilled that maternity benefits, because of the ACA and the essential health benefits, will now be, you know, required for women. So that's great. No one else will have to go through this the way I did.
Well, and the, I mean, first of all, congratulations on
it's a girl.
your baby.
She's 2 in a few months.
I mean, that's great. But, you know, what you describe, so many people do every day. I know people who pay out of pocket for services because they don't necessarily want to access service, you know, they don't want to have checked that box. They're terrified that they will be sidelined or branded or some other situation. So getting to the place where the rules are very clear, you know, there is no screening trying to identify conditions, and that everybody has access to the market. And what companies then have to do is compete on the basis of price and service. What a novel idea, as opposed to who can, you know, cherry pick the market and figure out who won't get sick. And but that is great that you had an interim step, and then by 2014, you know, the new plans with health benefits will cover all of those services for everybody. And you won't have to find a box. You won't have to, I mean, you will know that if, you know, this coverage is there. And I think that one of the challenges is to get beyond a lot of the misinformation that's out in the press and on the TV, and have these conversations with our fellow sisters to explain what really is in this act. Because what I find is that when you say to people, you think it's a good idea that kids can be on their parents' oh yeah, I like that. You know, you think it's a good idea that we won't have lifetime limits on benefits, or that children shouldn't be locked out of the insurance market because of, oh yeah, I like that. You know, do you think it's a good idea that you have ongoing coverage, or that you would have a choice if you lose your job or leave your job, that it shouldn't be tied? Oh, absolutely. Well, you know, we say, well, that is what it is. Should we have more doctors in underserved areas? Should we be training more nurse practitioners? And, you know, if you lose your spouse, should you lose your insurance? Well, no. So I think once people understand that really is what health reform is. That's what the law does. It's what it says. It's how it benefits you. And then folks are like, well, I like that. You say, well, then you actually should be supportive of this. But you all are so powerful, and your voices are so powerful, because everybody has, if it hasn't happened to them and their families, they have a friend, they have a neighbor, and it really makes this connection between, you know, what is a bill written on a piece of paper to real lives. And so the stories and the personal face of, you are the face of health reform. And, you know, you have counterparts in states across the country, but I just want to, you know, it is so powerful and so important that you tell your stories, and nothing is more powerful than what you've done today.